Hello, I'm Lindsay Deku with Emerge Ortho, and I'm joined today by Dr. Tom Scarritt, General Surgeon. Today, we're going to be talking about hernia surgery and some of the common questions that he is asked by his patients. Let's jump right in. First of all, Dr. Scarritt, tell us a little bit about what you find interesting or enjoy most about treating hernias and hernia surgery.
Yeah, so one of the things that I really love about hernia surgery is just how great the finished product looks. When you start a case for someone who has a hernia, and we'll get into this a little bit more when we talk about what causes them, but you've got this hole and contents coming through it, and at the end you have this nice flat repair that looks pretty. It looks like it's supposed to. Everything's back in place, and it's just such a good feeling to go from what you started with to the finished product. I also really love the fact that these can be very debilitating for patients, and so getting a good repair can really help give them their quality of life back. So seeing them in follow up and hearing them get back into activity is very encouraging and keeps me coming back to hernias.
Yeah, absolutely. I do have a couple of, before we get into the FAQs, I did want to ask about hernias. They happen in men and women, but more typically, what do you see?
Most commonly in men, and the most common hernias that we see are in the groin, but I think we'll talk a little bit in some of the FAQs. They really can happen just about anywhere in the abdomen.
Yeah, interesting. Okay. So let's jump into the FAQs. So tell us, first of all, what exactly is a hernia?
Yeah, and this is one of my favorite questions. I had a mentor in residency who was great at just breaking it down simply. A hernia is just a hole. If you think of, your abdomen as a sphere, anywhere in that sphere you can develop a hole, and then through that hole, what patients actually notice is the bulge. So the bulge is the contents of the inside of your abdomen coming through the hole. But when we go in to fix a hernia, we're not removing the bulge or doing anything like that. Our goal is to fix the hole.
Yeah, that's I never thought about it that way. So what actually causes that hole to form?
Yeah, and this is where you start to see hernias really in all different parts of the abdomen. So most commonly, like I mentioned, hernias form in the groin, especially in men. And that's because in men, the groin is a natural weak spot. Our testicles develop in the abdomen and descend through the abdominal wall into the scrotum. And when they do that, they leave behind a weak point. That weak point is sitting on the lower aspect of our abdomens. So over time, just being upright, lifting weights, straining, all of that puts pressure on these natural weak spots. And that's how those spots can open up and develop hernias. We see the same thing in the belly button. Because of the blood vessels that penetrate the belly button during development, that's also a natural weak spot that over time can develop into hernias. The other big category of hernias that we see are incisional. So anytime you have surgery on the abdomen where they cut through that abdominal wall muscle, that muscle becomes weaker when it heals. And so now you've got another, not a natural weak spot, but a weak spot caused by surgery that can easily develop into a hernia.
Interesting. Yeah. Okay, so how do you treat a hernia?
Yeah, so the tenets of hernia repair are, like I mentioned, there is a hole and contents that should be in the abdomen bulging through that hole. So the tenets of repair are: one, get those contents back into the abdomen. Two, and we don't always do number two, but two would be to repair the hole itself, to close it. And then three is to reinforce the repair with mesh. Now, there are cases where, especially in groin hernias, that there isn't really much of a hole to close, so we just reduce the contents and reinforce it with mesh, and that's enough. There are also cases where if we have a very small hernia at the belly button, sometimes we'll just close the hole and not reinforce it with mesh, and that's enough. But basically, those three components are what go into a hernia repair.
Okay, so are there any risks to delaying hernia surgery?
Yeah, this is another great question that we get from patients. And the truth is that it depends. The main thing that we would worry about in delaying a hernia surgery is developing what's called an incarcerated hernia that can then progress to strangulated. So an incarcerated hernia is when you have contents that are in the abdomen that go into the hernia but get stuck and then can't reduce back into the abdomen. And then those can progress to strangulated, where you actually start to lose blood supply to the contents that are in the hernia. and that can become a real surgical emergency.
Mm.
Outside of that, though, there are not a whole lot of risks to delaying. Whenever we see someone, we caution them to look for the signs of incarceration or strangulation and tell them to call or go to the emergency department right away if they notice that. But if they have a typical reducible hernia and want to wait a little while until it's more convenient, usually that's okay, as long as you're mindful and keep a close watch on it.
Great. Okay, so tell me about the different types of hernia surgery. There's open and laparoscopic surgery.
So this is what I spend a lot of time in my specialty training doing. And one of the factors is, the gold standard is the open hernia repair, but there are a lot of minimally invasive techniques. And I think they each have their pluses and minuses. Open is the gold standard. We know that it works well. It's been used for years and years and years. And we've gotten to a point where recovery from open surgery for hernia is really pretty comparable to recovery from laparoscopic surgery. Laparoscopy does involve smaller incisions, but we still have to insufflate the belly with gas, and that can cause pain. But the long-term results of both are very good in people who are experienced doing the different kinds of repairs. So a lot of it just comes down to surgeon and patient preference and having a discussion with your surgeon about what you think is going to be the right approach for you.
Excellent. Okay, so is there anything else? That's all the FAQs I have. Is there anything else that you tell your patients before or after surgery that you think would be important for potential patients to know?
Yeah, I think that one of the other things that we spend a lot of time talking about is post-op recovery. Usually the recovery from this itself is pretty quick. Within a week or two, you're feeling more or less back to normal. But where you had that hole is still healing. And so it's really important that even though you may feel back to normal, to not go out there and start lifting things that are heavy, because that's going to increase your risk of recurrence in the short term. The other thing that is probably even more important than that we talk to patients about is if you have a hernia and you want it repaired, it is imperative that you try and stop smoking. Smoking, we know, increases the risk of recurrence and makes it much more likely that any efforts to repair your hernia are just going to be wasted because it's going to come back.
Great. Thank you so much, Dr. Scarritt. Just so everyone knows, I'm going to put the link to Dr. Scarritt's bio in the description of this video. You can check out his bio for more information about him and his specialty areas. And you can also use that link to request an appointment with him. Thank you so much for watching, and we'll see you next time.